We are here today to discuss emergency at sea. We're going to talk about how you can treat them if they happen and how you can prepare for them.
Please note the content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
And here we have Dr. Wayne Lee, who's an emergency room physician and an experienced sailor, who's going to discuss the various types of emergencies with us. Wayne, do you want to introduce yourself?
Sure. Well, you got the name right. And, I am an emergency physician, and I did that for, 40 years or so. And but at the same time, I did a lot of sailing and boating of all sorts. And so I guess that qualifies me to talk about this a little bit.
Yes, a lot.
Absolutely.
Absolutely. How would you kind of classify the types of emergency that can happen while somebody is crossing an ocean?
I read this book one time by William Buckley, and I can't remember whether it was Airborne but it was one of his books. And he talked about preparing for emergencies at sea. He talked about, where you might have only 1 minute to deal with it, you may have 5 minutes to deal with it, or you may have a few hours or a day to deal with it. And each one of those requires some pre-planning. And so in his case, he assigned everybody a task of what to do if you only had 1 minute, and so on down that spectrum of time. I think the same thing should apply to your thinking when you're sailing at sea, and that you should compartmentalize it into to minor manageable injuries on the boat that you can deal with, and that everybody will keep going, and you get over it, so to speak. And then you have the other that are a little bit more severe. You may have a little bit more time to deal with those, to get somewhere, to seek help, etc. And then, of course, you have the emergent situation. Same thing as in the emergency room. We have the non-urgent, we have the urgent, and then we have the emergent that come in. So I think you have to think in those terms. A friend of mine says all the time, it's always personnel, planning, and equipment. So I think you can think in those terms too, that planning is probably the biggest part of that. Subsequently, you have to have equipment. That a lot of that's medication, if you want to categorize that as equipment. And then some of it might be splints, it might be sutures to repair small lacerations. And then for some of the more emergent stuff, vis-a-vis cardiac arrest, can I tell this story about my friend?
Of course,
yeah.
Tell the story. That's a great story.
I was on a trip down to helping take a boat down to Grenada, and with 4 or 5 guys in my age category, and we were a day or two out, and my friend came up from down below that was not a physician and said, "We've got a problem." And I said, "What is the problem?" We were all having fun and drinking beer. And so he said, "I can't pee." And we said, "Oh my gosh," and of course, I thought, well, you'll get over that. But sure enough, he had acute urinary retention, which he never had before.
Oh,
it just surprised us entirely. Luckily, the guy that owned the boat was a surgeon, and amazingly, he had red rubber catheters. And for those of you that don't know, a red rubber catheter is a catheter designed to stick into the bladder, drain it, and then take it out. There's no way to leave it in. A Foley catheter has a little balloon on the end of it that you can blow up, and once you put it in, it stays in. Our friend wouldn't let us do the catheterization, but he did manage to catheterize himself. But ultimately, we had to abort the trip. I think it would have been a much bigger emergency if we hadn't had those catheters on. So that's the type of things you have to think about. And I think you have to think about, and so in that context, you have to think about who's on board with you.
Right.
Their age, sex, and what are the things that might happen to them in that category.
So yeah, that's a very important point. So before you set off for such a trip, you really should think about who is on board with you.
Absolutely. I did a transatlantic, and I think 3 of us were in our 70s, and the other 2 were what you might call younger, probably 40 or 50. But when we were preparing for that trip, and as an ER doc, I've seen this happen so many times. It's just, you just can't believe what will happen, you know, with your friends and people you know. But I wouldn't go unless we had a defibrillator on board.
Right.
And so, and the nice thing about, I say the nice thing, but if you ever had to use a defibrillator, they're real cheap today. You can buy them for $1,000 or $2,000, you know, and so it's easy to have one. And you may have visitors on board, you know, you just never know. So with a defibrillator, it could make the difference. It could be all or nothing. So sometimes if somebody does have a catastrophic event and you use that, you know, you're out of the woods. You've got a lot of time. It you know, it converts them, and they're, you know, you got time to get into the hospital and so on and so forth. So that's an expense unlikely to have, but you'd hate to not have it if you need it.
Right. So if you have a young crew and nobody with a, if you don't have anybody with a cardiac history, maybe you don't need it, but it's certainly something to think about.
Yeah, I think it's so inexpensive today. If you're going offshore for a long time, and I'm not sure where to draw the line, but I'd say with people over 40, certainly over 50, you know, I've seen, you know, a lot of cases like that.
Sure.
So, and that's, you know, the odds are against it, but, you know, you can probably sell it when you get back.
Yeah, that's true.
Better safe than sorry.
Absolutely.
If you had to say, you know, you can go and buy a pre-packaged kit for sale. They have the typical bandages and ointments for burns, for like sutures and way to suture, and obviously you need to know how to do that, but I think it's pretty basic. Anybody can really learn how to put a couple of stitches in a wound. How about splints? Should we carry splints on board?
The short answer is yes. But let me go back to, if you don't mind, let me go back to the prepackaged affair. I actually like the prepackaged kits, but I think that, and they come in different size with different stuff in them, you know, and you can tell them what you want, and so I think it's handy to perhaps having a physician advise you. Yeah. Maybe better yet, a physician sailor advise you what you need and what you don't need. But you know, I think splints, for instance, you could probably come up with. We're very, as sailors, I think everybody knows, we're very MacGyver-ish, and so we could probably come up with ways to splint almost anything.
As long as duct tape.
However, some of the splints are real nice. But I think more importantly, when you talk about suturing, you know, suturing is not hard, but it's much easier to do a staple. Yes. You know, and so that's a lot. And most people wouldn't know that, you know, but that'll take care of, you know, 95% of wounds, at least temporarily, you know.
Maybe not as cosmetic, but
not as cosmetic, but so I think those types of things, you know, you have to think through those. The Foley catheter, I think burn creams are important. I told you earlier that I sail my boat in a race from Daytona to Bermuda. I have a 50-year-old sailboat, and I've sailed it for many years.
Yes.
And my joy is that I was in the Antigua Classic Yacht Regatta, and ultimately they put my boat on the cover of Ocean Navigator.
That's so cool.
You know, so I just carry that around. You know, that was. It justified the $1 million I spent on repairing this boat. But en route to Bermuda in this race, I accidentally scratched my cornea, and some of you contact wearers may have had that experience, but it's very, very painful, and it can turn out to be a problem. Amazingly, I had put on tetracaine, which is a local anesthetic that you put in the eye. It's not ideal. It's not what you normally want to do, but when you're 500 miles out at sea and you're in a lot of pain, that saved my bacon. And then I had some ophthalmic antibiotic ointment that I put in with that. You can patch it or not patch it. There's a lot of debate on whether to do that or not. You have to know how to do it. But that was a good, and I just lucked out. I don't know why I put that on board, but fortunately I had it. I was in a lot of pain.
That's great.
I probably would have rubbed it raw if I had it. You know.
So Wayne, what do you think about the most common medical emergency? We spoke about cardiac arrest. Hopefully that's a rare event, and it's great if you have a defibrillator on board. Most people would not be qualified to administer medications for cardiac arrest, so that's about it. It's like, you know, shock. I mean, that's.
But there's, and I think this is a 1 in thousand,
Yeah,
you know,
right.
but we're talking about, so we can spend some time on it. But the reality is that if you shock them, you may convert them, and then you're home. And so it's
Yeah.
really not much about medications.
Right.
It's just about having the shock.
Right.
And ultimately, it is in a more sophisticated way, but it could save somebody's life if
Right.
you had it. That's why they have AEDs on
Right.
every street corner.
Right,
You
right,
know,
right.
and it's not rocket science.
Right. How about another type of medical emergency? More commonly, we have people with diarrhea, people with nausea and vomit, some sort of GI tract infections. What would you recommend that people carry? Antibiotics, some basics, ciprofloxacin, or?
Yeah, I mean, there are a number of, let's call them all-purpose antibiotics. They're not, that's a misnomer, they're not all-purpose, but Cipro and, of course, erythromycins and a variety of drugs, the ampicillins in that category, Keflex, all those. So I think it's, useful to have a number of those on board.
Right.
And you sort of have an idea. I would approach it from the standpoint of, if I had this, which one do I use, rather than what can I use this one for,
Right.
which may be 500
Right.
things.
Right.
GI problems are common. And then, of course, you have to treat the nausea and the vomiting, perhaps, if they have a gastroenteritis at both ends, so to speak. So I think having the ability to control both the diarrhea, control the nausea and vomiting, control if it's infectious, perhaps, which is not as common, but
Right.
if it is, I mean, most food poisonings are going to last 24, 48 hours.
Right,
Sure.
and just
And then you're through.
self-limiting, yeah.
Yeah.
But so I would have those types of things on board. The other thing you mentioned is the IV fluids.
Right.
They're going to need hydration. Of course, Gatorade is my favorite, or now Pedialyte has a version,
Yeah.
And but some way to hydrate people, you can get their nausea and vomiting down. If you can't control that, you're really sort of stuck with trying to get an IV in. I think that's tricky and challenging. It could be done, and you have to be careful with it, not too much, not too little.
Yeah.
And so it depends on, for you, I think.
Yeah. For
It'd be easy,
yeah.
and people can be trained to do
Yes.
that. I think that's my approach would be to get the nausea, vomiting under control
and
and
drink
hydrate
it.
orally.
Yes, if the gut works, certainly should use
right.
that.
And suppositories, people think, because you can't control the vomiting by a pill, if
Right, right.
So suppositories are very useful,
Yeah.
both for nausea and vomiting and a variety of other things.
Yeah, exactly right.
So
Yeah.
that's
So
a good
Zofran
idea.
and some
Zofran's great. Of
Zofran's
course, we use
great.
that, yeah.
It's great, and some Pepto-Bismol.
I love Pepto-Bismol.
Yeah.
People think because it's over the counter,
Yeah.
that Imodium,
Yeah,
those are all the sort of first aid things.
yeah, something to have.
I was in the islands in the Bahamas, and I had a friend of mine that's a physician, emergency physician, 10 years older than I am, and he actually fell off my boat getting onto the dock, and in the process of going down, he just took skin off everywhere, and it was just blood was everywhere. It looked terrible. It was kind of humorous in a way because the crowd gathered and everybody was yelling for the local island rescue to come. And we said, you stand still. We're both ER docs.
Right, I think we're good.
And one's a victim, one's a doc. But anyway, one of the things that taught me, and this is different today, I didn't have the bandages to manage that. I didn't have, I had to change his dressings twice a day. He stayed with me. I had to change his dressings twice a day for about 10 days.
Oh, wow.
That's hard.
And, so Adaptic, non-stickable dressings, a lot of them.
Yeah.
Stuff that will soak
Some
up.
zero form, some to cover.
Yeah, so it's nice to have that. They're kind of bulky.
Yeah.
But if you can find a place to put that, it's nice to have a lot of dressings.
Yeah.
Which might come into play if you had burns.
Yes.
Yeah.
And so obviously some Silvadene.
Silvadene is a great drug to have. Yeah. Great ointment to have. Yeah.
Right.
Absolutely.
One of the most common problems that I've seen in the islands are ear problems.
Really?
Yes.
Yeah, and so the question is it a middle ear problem? And that's from diving or maybe flying.
Right.
Or is it a wax plug
Right.
or an external otitis,
Right.
which is people putting Q-tips and
Right.
scrubbing out their ears. First of all, you have to be able to look.
Yeah.
So you need an otoscope. I might mention that today they make good fiber optic scopes for your iPhone.
Yes.
Oh, really?
That you can look in your
Yeah.
ear.
Oh,
Probably
wow.
other places too. But you could. So I think that's real handy, and you'll encounter a lot of ear problems. And you know, many times it's not about taking care of myself or my crew, but I'm taking care of
Somebody
other
else,
people.
of course.
You know, and so I think ear problems are real common, and so being able to see that and then being able to treat, depending on which it is, you have to know how to flush out wax plugs. That's a very common affair,
Right.
and it's not that hard, but it takes a lot of patience.
Right.
You know,
And a big
so
syringe.
that's a common thing. The other thing that, of course, you got man of war stings, and you know that's common. But everybody knows on the boats know how to treat that. I'm thinking about the common injuries, the common problems that you can manage on the boat are injuries. And that'll be lacerations, common hand problems with winches, particularly if you have people on board that aren't accustomed to it.
Right.
That can be lacerations. I was saying to you earlier that it's when you get into hand lacerations and perhaps others, it's useful to be able to talk to somebody
Right.
that has some experience with those. And so it may not be anything to worry about. It may need some expert repair.
So that's a great point, Wayne. So do you recommend that people before leaving they establish contact with the doctor and land a service that they can call and bounce off ideas and ask questions when they're in trouble?
Yeah, I think there are several layers of that. One is being able to call someone, and that could go anywhere, you know, from you have a number of emergency medicine friends.
Sure.
You could probably call any of them and get
Yeah.
some advice and know if this is bad or not so bad.
Yeah,
you know?
yeah, of course.
And that would probably be good advice. There are companies and there are resources where you can call, and there are usually people stationed in the emergency room that you can. It's a service you can buy,
Sure.
and they will give you advice and counsel. I think the important thing is, what if you need to get off the boat, you know? And there are a number of services for that. Not only can you buy that, but you also have to think about, let's say you get off the boat, but they take you to a hospital in another country. So the question comes up about paying for that.
Right.
So there's two issues there. One is, who gets me off the boat,
Right.
you know? And you can buy insurance to do that.
Right.
It may be that they only take you to the local hospital. That may or may not have the capability. Either way, it's probably going to cost, and somebody's going to have to pay for it. Medicare, well, you're not Medicare, but Medicare will cover it. You know, so you need to get those two pieces together. They're not the same, but you need to cover both of those.
Begs the next question, which is critical care transport. So it'd be probably wise for somebody who has some health condition that may require transport back to the U.S. to make sure that their insurance covers for a critical care transfer for airplanes and ways to come back.
Yeah, and I work for, like I said, I work for another company, and we move some people, and that's not our primary business, but we have to move people. And sometimes we're moving them from one location to a hospital in a nearby country. And in some cases, that's not good enough, and we have to move them back to the United States.
Right.
So it's not always a matter of going back to the United States. It may not require that. Then the other thing is the costs are different. But then you get into, again, who's going to pay that hospital bill in the hospital, say, out of country.
Yeah.
Right.
And so it's something, and that's where I talk about planning. I believe that probably, the likelihood is that you won't have any major problems health-wise, but 95% of dealing with whatever you have to have will be from planning.
Right.
Well, is how successful you are, and communication.
Right. Yep. So plan your equipment on board, plan your communication method, plan who you're going to talk to,
Right.
plan your insurance coverage for within
Transport
your means,
and care.
Transport and care.
And care.
Right.
Yeah.
And so that should cover most of the emergencies. Basically, every sailor should look at their own level of expertise and what they can do. If they can repair a laceration either with staples, or in my case, I'd be very comfortable, of course, I'm a surgeon, to use sutures. Being able to look at most medical emergencies nausea, vomit, diarrhea, and have the right medications on board, infections, some antibiotics, all sorts of bandages to treat burns, to treat common abrasions. And then, if you know how to have IV fluids in case of severe dehydration and ability to put an intravenous line. Other things that are important that we just learned today: eye injury, corneal abrasion, which is very common actually, as a matter of fact.
And I wear contacts, so.
Yeah, that's very common.
Very common.
Yeah.
Look inside the ears, make sure the pain is caused by maybe just by wax that can be removed by flushing with some tepid water and some peroxide to dissolve the plug a little bit. You need to have a large syringe. People should not be tempted to pluck it with a faucet.
I think that, and that's a great example. Let's say you weren't a physician,
right?
But even as a physician, you haven't unplugged a lot of ears,
right?
But that's a great example. Like, it's easy to perforate the eardrum.
Yes.
Well, if you try, you can perforate the eardrum. But I think there's this is a good example of calling your friend or some prearranged, and walk me through how to do this safely. Right. So it's not a big deal, but you hate to make it a bigger deal.
Right.
Absolutely. Yeah. But with technology today, as you mentioned, you can look with your iPhone, take a picture of it, text it to your friend. Yeah. And same is actually most conditions. The eye, you can take a picture.
Yeah, right.
A laceration, you can take a picture.
Actually, the other thing is handy, and I had this, but I already knew what I had, was to take some fluorescent stain. You can either buy the strips or the drops, and so you can put it and have a UV light. A little blue light, which are easy. You can get them everywhere. You probably have one on the boat. But anyway, and so you can put the drops in the eye, and you can tell if it's a corneal stain.
Right.
Yeah.
And there's all sorts of training. I think, everybody spends a lot of time on going to CPR courses. Yeah. And I think you need to know how to do that. Yeah. And have the things that you might need for that. Bag valve mask, whatever, to ventilate patients if you had to do that. But there are a lot of little things that we do, like with an eye. How do you raise the eyelid up? Right. There are a lot of little no-brainer items that ER doc could walk you through. Right. With a Q-tip, we have joint dislocations, and that anterior shoulder dislocations, and there are things that can be taught that could save your trip. Right. I think that most people would not be comfortable to reset a joint, but maybe they could. That's true. I don't know if most or not. It might be depending on how. Yeah. Maybe somebody who said recurrent joint recurrent shoulder dislocation. But that's something that's easy. I mean, I wouldn't say easily doable, but doable. Yes. And in some cases, like if you had. I don't know. There are some emergency dislocations where you really have to, and let's say you have a fracture dislocation and it's angulated. Yeah. Well, somebody needs to pull that back in place a little bit, or you're going to lose a foot or a hand or something. So that's very important. So the ability to at least knowing how to check for pulses. Yeah, right. That's very important. Yeah, to know if there's blood flowing to a limb after a fracture, and how to kind of pull it back and splint it so that the blood vessels strain up and bring blood flow to the limb. That's very important. Yeah, and I think all these things, I'm thinking about our viewers, that all these things are not, I don't think that you go to, to a school to learn how to do all that. I really think that 90% of that is about having a line of communication with somebody that knows how to do that and tell you how to do that safely. Right. That's a big deal. For sure, because if I didn't have you telling me what to do, I wouldn't feel comfortable doing a lot of those things. So I would definitely need to have somebody talk me through it. And then of course you have your abdominal emergencies, right? Appendicitis, perforated ulcers, acute diverticulitis, maybe bleeding from orifices. So what would you recommend that somebody does in those cases? I'll tell you something that happened to me. I took a hike in the Himalayas, and I hiked around Annapurna, which is one of the third largest, I think, mountain in the world. And I walked around it with some other people, and up near the Tibetan border, a young guy, and I was an emergency physician at the time, and I had actually done some surgery. And a young guy developed right lower quadrant pain and was pretty sick. And I thought, my gosh, he's got appendicitis. And so the question comes up, and there's no one around, you know, to come get you. And so I actually, in those days, which was really a bad idea, but I wondered if I could actually take out his appendix there.
Without
Oh my
anesthesia.
goodness.
With, you know, and but I had
Oh my
taken out
goodness.
some. I didn't think it was that hard, you know. And today, you know, we'd say, well, let's put him on a lot of antibiotics and get him down the
Yes.
mountain.
Yes.
In those days, everybody thought you'd die if you didn't get it out, you know. But at any rate, but that's again, that's back to being able to communicate with someone. We
Right.
didn't have set phones and stuff at the time. And so I think that abdominal complaints, both from a diagnosis standpoint and also from a management standpoint, are, you know, they're difficult, as are lung problems,
Right.
and so on. And so you have to think about women and men, a whole different set of circumstances.
Right.
So that's really going to be about communication.
Exactly.
I do think one of the things that comes up is kidney stones.
Right.
So you really do need some pain medications, you know, and everybody's going to want to today use Tylenol and Advil. That's probably not enough for a big
Not for a kidney
stone.
No.
So, you know, you're probably going to need some opioids on board, you know,
Yeah.
something that you could do to, you know, really take care of some pain. Have you had a kidney stone?
No, thankfully I've never had a
It's one of
kidney
those
stone.
things that none of us want to have.
Our friend did, and he was in a lot of
Yeah.
pain.
It brings you to your knees.
Yes.
And so
I've seen many people with kidney stones, obviously.
And so, but and frankly, there are. If you called me up, and most ER doctors and a lot of physicians, if you call me up with someone and you gave me the right story, I could almost put $100 down and be right that, you know, kidney stones are fairly classical.
Fairly classic. Yeah.
You know, appendicitis is fairly classical. Diverticulitis and perforate, that's a little bit harder.
Yeah.
You know, antibiotics, so on and so forth. GI bleeds, but hopefully you don't see that, you know.
Yeah, so for appendicitis, I mean, the treatment now with antibiotics and waiting, and hopefully the body will respond well off the infection and make it better so that
But you'd want to start moving them or try to move them.
you need to do that.
Right.
That is something that you may want to
Right.
consider calling an
Yeah,
helicopter.
yeah, exactly. If you got one around.
Not if you're in the middle of the ocean and there's
and
no such a thing.
the North
But
Atlantic.
there are a number of ships going around that may come to your rescue and bring you on board, and maybe they have doctors on board, right?
Well, you know, I sailed a 50-foot footer from Maine to Scotland.
Oh, wow.
With 5 people on board through the North Atlantic. And at one point in time, I got nervous about the icebergs and little bergy bits and stuff, and we lost our radar.
Oh.
And of course, that wouldn't show everything. But anyway, it's interesting. I talked to a guy with the Coast Guard, I think in Newfoundland, I recall, and I talked to him, and I was trying to figure out where. And he said, "Don't worry, there's ships all around you." I said, "Really?" And he said, "Yeah, there's a tanker 500 miles east of you."
Oh my goodness, all around
So,
500 miles. Oh yeah, right next door.
Yeah, their frame of reference is different. But I think your point is well made, is that I sort of watch this and pay attention all the time, but that, you know, and if anybody's out here that's, you know, real sailors, they'll know there are a lot of people who come to your rescue.
Yes.
Yes.
And North, South Atlantic, you know, and so that's a big deal. It's about communications
Right.
and your EPIRB and so on and so forth.
Yeah,
you know?
and nowadays you have
And
satellite phones.
Yeah,
And
so there are a lot of people, that's the rules of the sea. You know,
Yes.
They'll come to your rescue.
that is
500
fantastic.
miles away.
That's amazing.
Yeah.
Well, we saw that also in the Vendeglobe this year.
Yes.
That they, you know, did you see that?
And they, it's pretty amazing.
It's incredible.
What they do.
Yeah, 'cause-
in terms of the rescues. you
And
know?
to your point about communication, it was key that he was able to communicate to his team that he was having a problem and he needed somebody to come and rescue
Right,
him.
right.
And he lost communication right after that.
Yeah.
And then they were able to divert the closest person to
Yeah.
him, and then also I think 3 other boats. But then
Yeah.
he was able to be rescued.
Yeah, the other thing are teeth. You know.
Oh, good point.
And,
Forgot about
people
those.
get broken teeth.
Ooh.
And you know, they can knock out teeth or break off teeth. That's a bigger problem, I think. And so you can buy these little kits that come to do temporary repairs for for teeth.
Interesting.
And I'm not it's funny, I haven't repaired a lot of teeth, but you'll want to be able to put a temporary
cap on it.
Cap on it. It's not really a cap, but a temporary covering for it, which might prevent the pain and infection, etc. You might need antibiotics if they get an abscess.
Yeah.
You know, Chittister, I think when he sailed around the world, and Gypsy Moth, I think he had an abscess and he pulled his own tooth, as I recall, or something like that. So, but anyway, there are tooth kits, so don't forget to get the teeth kits.
Oh my goodness! Yes.
Yeah.
Good point.
So in the extremes, what's your feeling about more extreme situation? Pneumothorax, crushed larynx, put in a cricothyroidotomy or a chest tube. What's your?
I think those are things. I mean, a cric is actually, I think it's emotionally trying, but it's in a lot of cases it's fairly easy to do, and it's fairly easy to train how to do it. You know, so it's not the same as doing a tracheostomy, but it is something that would save your life if you had a piece of meat in your throat and you couldn't get it out, or something else for that matter. So that's trainable. What was the other one you asked?
Chest tubes.
Yeah, chest tubes are really not, they're about decompressing a tension pneumothorax, let's say.
Right.
And so a little bit of that has to do with how to discern a tension from a non-tension, which is not hard.
No.
And then you can put a needle with a flutter valve in. And Frank, it's funny because in the fire rescue services, you know, a tension pneumothorax is, I always call it a shock syndrome, because people are going to drop their pressure and they're going to die. And so it's an either-or situation. So both that and a cric are either-or situations.
Yeah, you got to
If you don't do it, there's a good chance the patient may die. And yet there are things that you can do that are relatively easy to do. And you can buy kits that are really easy to use for both, actually.
Yeah.
Now you're getting, you know, and you know, you're trying by adding stuff and adding experience and adding communication, you're trying to mitigate risk. The fact of the matter is you can't get rid of all the risk.
No.
You know, but you have to decide, you know, how much do you want to get rid of? You know, and so we can keep on going, and you can, but there are some things that are easy to do that could be life-saving.
Yeah.
Well, thank you very much. I think that was very informative. I hope our viewers enjoyed it.
Thank you.
Thank you.
Thank you.
You're very welcome.
Really. And so as we prep for the Bahamas, we're definitely going to be making our list and buying lots of supplies. And this has been really helpful, at least for me.
All right. Thank you very much.
You're very welcome.
you.
Enjoy it.